it's me again, and I forgot to add this to the other video. The amount of doctor visits that you have. It depends. Once you actually get your surgeon, okay, I saw my general practitioner because you have to have a pre-surgery physical, but my general practitioner knew that I was going to see, that I had this plan to go see my plastic surgeon, so she knew that I was going to need a physical. So general practitioner visit for a pre-surgery physical. Most of the time, your plastic surgeon, if it's a breast reduction, they will want to know whether or not you've had a recent mammogram. Some don't. My plastic surgeon, he knows that I take care of all my stuff, so he just asked me, did you make sure you got your mammogram? So a mammogram is another doctor visit. I also had an EKG done when I got my physical done with my general practitioner, but if your general practitioner doesn't do them in the office with the little machine, that might be another doctor visit to the cardiologist. Just saying. For the actual plastic surgeon, you will need a referral more than likely, okay, to go to the first visit, the first consultation visit, okay, where they decide whether or not you're mentally, psychologically prepared. Now with me, again, Dr. Thompson was supposed to do this 3 years ago, so we already knew each other. We already had a rapport. The very first time I went there, they wanted to know what was going on with me. They looked at my medical history. They took measurements, took pictures, and then he sat in with me and just talked to me about regular stuff. And what I learned from that is they're trying to just get a take of your mental attitude and your clarity. Like, are you really prepared for this and that kind of thing. Then what they do is they set you up for a pre-op appointment. And what they do in between that time is they run everything through your insurance to make sure that everything will be covered. And they call you. Then you go in for your pre-op. In that first appointment, though, they will also have you watch a video showing you the video of the surgery, the whole procedure and everything, so that you are fully aware of what it's going to take. Then, like I said, then you'll wait to see if everything gets approved through your insurance. Then you go for your pre-op appointment. And that's just, he'll ask you, he or she will then ask you again, are you sure you still want this? That kind of thing. Make sure everything's set up. And then your next appointment is your surgery date. And then usually the day after, you go in for your post-op appointment, which is what I did yesterday. And then at your post-op appointment, they'll take off your bandages. Some people get their drains taken out. Other days, some people might have to leave them in. Who knows? And then they will set you up for another one, usually within, 10 days, 2 weeks. Mine's a little bit later. But like mine will be on the 16th. So, total for the plastic surgeon is 2 pre-op appointments, the operation date, 2 post-op appointments so far. I might need one after the 16th. I'm not sure yet. So that's that. But as far as even before the plastic surgeon, I saw my general practitioner for a physical. Okay. I did a mammogram, and if your general practitioner doesn't do an EKG for your heart for surgery, then you might have to see a cardiologist. So those are all your medical appointments that you would have to have in order to get all this done. So I hope that answers the questions about the doctor's appointments. Okay, bye. Love ya. Mwah.